Hey everyone, and welcome to The Explainer. I am so thrilled to have you here with us today. If you're the kind of person who just wants to cut right through the noise and get straight to the facts, well, you're in exactly the right place. Today, we're taking a structured, completely science-backed journey to unravel one of the most defining global events of our lifetimes, the COVID-19 pandemic. Using official data and research, we're going to break down the whole shebang, from the exact origins of the virus to how it managed to spread across continents, and finally, how we can actually protect ourselves moving forward. So let's just jump right in by asking the core mystery here. How on earth did a completely novel, totally unidentified virus emerge out of nowhere to impact literally every single continent on the globe? I mean, it's a fascinating mix of biology, geography, and human interaction. To really understand how the entire world essentially hit pause, we need to put on our detective hats and trace the clues left behind by the virus itself. Here is our roadmap for today's deep dive. We'll start with the origins of a novel virus, followed by understanding SARS-CoV-2 and how the virus spreads. Then we'll look at the global pandemic scale, tracking other viral threats, and wrap it all up with prevention and protection. All right, let's kick things off with Section 1, Origins of a Novel Virus. To really wrap our heads around what happened, we've got to travel back to the end of 2019. This was a time when this pathogen was completely unknown to the human immune system. Now, the formal identification of the outbreak happened in late December in Wuhan, China. But the biological reality? That actually started much earlier. Suspected early cases might have popped up as far back as mid-November of that year. And what is absolutely crucial to note here is that the first known human case, someone who started showing symptoms on December 1st, 2019, was actually not linked to the suspected seafood and wildlife market in Wuhan. But here's where it gets really interesting. Even though that very first known case wasn't tied to it, environmental samples taken all over that market came back positive for the virus, and those positive hits were specifically concentrated right in the areas where the wild and farmed animal trade was happening. So this tells scientists that the virus most likely originated as what we call a spillover event, jumping from an intermediary animal host into human populations. Because of that, the market either served as the direct origin point or, very likely, acted as a massive amplifying setting for the initial spread of the virus among humans. Okay, moving right along to Section 2, Understanding SARS-CoV-2. Having traced the timeline and geographic origins, let's get our definitions straight, because people mix these up all the time. We hear a ton of acronyms thrown around, but precision really matters in virology. There's a fundamental distinction you need to know. SARS-CoV-2, that is the actual name of the physical novel coronavirus strain. COVID-19, on the other hand, stands for Coronavirus Disease 2019. That's the resulting respiratory disease caused by an infection from that virus. So while the virus usually causes respiratory symptoms that might just feel like a cold, the flu, or pneumonia, the disease, COVID-19, can actually attack way more than just your lungs, affecting other parts of your body too. Which brings us to Section 3, How the Virus Spreads. So how exactly does this specific virus manage to jump from person to person? Well, the primary way is straight through the air. Transmission mostly happens when an infected person sneezes, coughs, speaks, sings, or honestly, even just breathes while they're in close proximity to someone else. Those virus-containing particles get inhaled or land directly onto the nose, mouth, or eyes of the next person. Now, much more rarely, but still pretty remarkably, transmission can happen via surface contact. The data shows this virus is tough. It can survive for a few hours on porous surfaces like cardboard and copper, and actually up to a number of days on hard surfaces like plastic and stainless steel. But here is a massive piece of the puzzle: 5 to 6 days. That right there is the average incubation period, the time between when someone is first infected and when they actually start feeling sick. Now sure, that incubation period can range anywhere from 1 to 14 days, but that 5 to 6 day average is an incredibly long window. It means an infected person could just be going about their daily life, interacting with friends and family, and silently spreading those virus-containing particles, entirely unaware that they're harboring a novel pathogen. Let's zoom out a bit for Section 4, the global pandemic scale. When you mix a totally silent incubation period with a highly contagious airborne respiratory virus, the results are, frankly, explosive. Remember, because SARS-CoV-2 was a completely new strain of coronavirus that had never been seen in humans before, absolutely no one had pre-existing immunity. The entire human population of the planet was completely susceptible, all at the exact same time. It didn't just stay a localized outbreak, it rapidly morphed into a pandemic, blanketing continents globally. To truly grasp the mind-boggling velocity of this spread, let's compare it to a previous coronavirus threat. Back in late 2002, the original SARS outbreak emerged. Over the course of about 8 months, it caused around 8,000 cases across 33 countries. Now, in stark contrast to that, within just the first 2 years of the COVID-19 pandemic, more than 450 million cases were reported worldwide. And because so many infected people were asymptomatic or just never diagnosed, the actual number of cases is assumed to be significantly higher than that. But behind those massive, almost unimaginable case counts is a very real, very tragic human toll. To kind of ground these statistics for a second, consider this. As of June 1st, 2024, nearly 1.2 million people had died of COVID-19 in the United States alone. It's just an incredibly sobering reminder of why understanding how highly contagious viruses spread isn't just some academic exercise. It is quite literally a matter of life and death. Shifting gears now, let's look at Section 5, Tracking Other Viral Threats. The harsh reality of public health is that COVID-19 isn't operating in a vacuum. It exists in this much broader landscape of emerging pathogens. Health agencies have to constantly divide their attention across some incredibly diverse biological threats. On one hand, you have widespread respiratory threats. They're continually tracking the seasonal flu, RSV, and of course, the ever-emerging variants of COVID-19. But at the same time, they've got to monitor fundamentally different pathogens, like deadly hemorrhagic fevers. For example, trying to manage an Ebola outbreak requires a completely different global response strategy, totally different clinical guidance, and different infection control toolkits compared to what you'd use for an airborne respiratory virus. Which leads us perfectly to our final part, Section 6, Prevention and Protection. Understanding all of these threats is what informs our defense strategy. Effectively fighting a pandemic really requires stacking our defenses. Think of it as a 3-tiered approach. First up is primary prevention. This means stopping the infection before it even happens through proactive things like optimizing indoor air quality, masking, social distancing, and getting vaccinated. Next, you have secondary prevention. That's prioritizing early detection through widespread testing and quarantine protocols to literally halt the spread in its tracks. And finally, tertiary prevention, utilizing advanced therapeutics and hospital care to manage severe disease and prevent long-term complications. By stacking all these defenses together, we aren't just protecting ourselves as individuals, we're actively depriving the virus of the opportunities it needs to mutate, which ultimately limits dangerous new variants from popping up. Because, as we've learned today, viruses mutate. It's just what they do. The very nature of pathogens is to constantly evolve, which leaves us with this final, really vital question to think about. As these viruses continue to circulate in animal reservoirs and adapt, are we truly prepared for the next global spillover? Understanding the facts, the data, and the real science behind the COVID-19 pandemic is hands down our best tool for ensuring that next time we are ready for whatever comes our way. Thank you so much for joining me for this explainer, and keep asking those important questions.